Story starts with Susie. Susie is a 34-year-old woman living in Edmonton. She's really happy because she's about to be a mother, something she's wanted to do for a really long time. Now she's finally stable enough to commit to this new lifestyle. Susie enters labor. She's rushed from work to the hospital. She finds herself in a delivery room. Several hours of labor, but she finally gives birth to her daughter, Becky. Becky looks so tiny and innocent. Susie's so happy. All she wants to do is hold her daughter forever. One of the nurses measures unusually low levels of oxygen in her baby. The nurse tries again to make sure the saturation levels are being read correctly, but Becky's showing less than 80% oxygen in her blood. This is extremely low and commonly indicative of heart or lung issues. Becky's rushed from the Royal Alex to the Stollery Children's Hospital in hopes that they can properly diagnose her and treat her. In the meantime, Susie's feeling quite down. Her only wish was to hold her newborn baby daughter. Susie's recovering from childbirth at the Royal Alex, but she can't stand to be away from her baby, and against the recommendation of her medical team, she leaves the hospital early to be at her daughter's side at the Stollery Hospital. Once discharged from the Royal Alex, Susie makes her way to the Stollery. She spends endless hours waiting outside the operating room, thinking about the worst, thinking about the things that are happening to her daughter. She spends long hours waiting while Becky has several operations. She feels isolated and cannot even begin to think about her own health and well-being while this is happening to her daughter. She can't even sleep or eat. Whenever the doctors and nurses come out to give her new information, she feels they don't always empathize with her situation. This medical and sterile environment feels cold towards her feelings of helplessness and sadness. When not in the operating room, Becky's in the intensive care unit. Susie isn't even allowed to touch her daughter and sometimes is traumatized by the medical procedures that are performed. She's not properly mentally or emotionally prepared for the things that are happening to her daughter. So the days become weeks and the weeks become months. And Susie has begun to notice symptoms of post-traumatic stress in herself. She has episodal triggers where she's overwhelmed by memories of her daughter's treatment in the hospital. The stress and anxiety is sometimes so much for Susie that she can't even find her way home or remember her phone password. And as baby Becky nears stability, the medical team start to give Susie document after document. These poorly designed and mismatched papers are intended to help Susie care for her daughter independently at home. Susie finds it nearly impossible to sift through all the handouts and differentiate between what's important and what isn't. Also, they're training Susie to operate special medical equipment and manage Becky's consumption of drugs. While learning how to do this, she finds she also has to take extra time to look through all of her medical handouts and papers and pare down the most essential information. After going through such a traumatic experience in the hospital, this action itself becomes exhausting and takes away from her time with little Becky. Susie is also having trouble keeping her friends and family updated on Becky's condition, any sort of minor or major progresses, and any daily events. Susie gets friends and family members asking her to share stories constantly, but dislikes posting anything on platforms like Facebook due to insensitive individuals commenting on her posts. So let's fast forward a bit. The day of discharge arrives, and Becky finally gets her little inpatient bracelet cut off, and she's able to go home with her mother. Although Susie was happy that the hospital journey was finally over, she didn't realize at the time that the whole new journey of home life was about to begin. The role of medical caregiver was now transferred from the hospital team to Susie. And after spending so much time at the hospital, she found herself anxiety-ridden while adjusting to the new way of life at home. She often found herself wondering, why didn't they tell me that this is what it would be like when I got home? The doctor visits continued after discharge, and Susie finds that she's having to reference old materials handed to her by the doctors while Becky was still an inpatient. And even though she's an outpatient, it requires extensive amounts of time to update all of the new doctors on what happened in the hospital. This takes away from valuable time that the doctors have to address the issue that Susie was actually at the appointments for. Susie finds that she's constantly burnt out from all the work that her new life entails. One day, while out for a walk, Susie meets another mother, Megan, who went through a similar situation with her young son at the stollery. She tells Susie about something that greatly alleviated her stress while she stayed with her son in the hospital. Megan says she used an app called Advocate, which is especially for families going through the Stollery Children's Hospital Cardiac Unit. The Advocate app provides the parents of children with congenital heart disease an opportunity to collect, organize, and share their experiences at the stollery. Advocate focuses on 3 key features: stories, medical box, and cardiac info. The stories feature is a journaling element which allows parents to record their inpatient journey with their child while on the cardiac unit. Megan explains that she used it to write down her child's story in one place and also write updates every day. She was then able to share her son's story with other cardiac families going through similar situations, as well as those updates she was able to send en masse to family members and friends. This created more mental space for her and allowed her more time to divert her attention to other more pressing matters. During her long wait times in the ICU, Megan found some solace and peace in reading stories from other families and patients going through this unit. She even connected with them in real life. This built a strong network of support around her. The medical box feature was especially useful for Megan as a guide for collecting and organizing the most important and pertinent information for her child. Megan used her waiting time to fill out this information from several sheets of medical documentation she would receive over the course of her stay. At the time, she didn't see the immediate value in this until her child became an outpatient, and she had often had to reference the information while at home. At several times throughout her hospital stay, Megan found herself overwhelmed with information about heart anatomy, anomalies, conditions. She started out Googling her questions, but soon found herself more confused than ever, with often conflicting data, and often having to sift through resources that were not always approved by medical professionals. With the cardiac info section, Megan was immediately linked to the best resources for information recommended and approved by Stollery Hospital staff. The cardiac info section provided Megan with the opportunity to start collecting important information handed out to her by doctors via the phone widget, and even kept photos of the doctor's sketches for future reference. But what if I forget I even have this app? Susie asked. I was so stressed out at times, the last thing that I would think about was filling out form fields. Megan assured her that the app was linked to her Google Calendar and would send friendly reminders and notifications after outpatient appointments to update any medical information. She would also receive alerts when any new messages came in from other cardiac families. Susie took this into consideration and decided to give Advocate a try. She was already in the process of organizing this huge binder full of documentation that she got at the hospital, so maybe this would help. After a few weeks of using Advocate, she began to notice the benefits of the app. She no longer found herself struggling through an explanation of her child's heart condition at outpatient clinic visits. She felt less isolated and depressed as she received more support, encouragement, and understanding from families going through similar experiences. She even began a support group with patients meeting once a month for coffee to chat about things and help each other out. Ultimately, Susie felt more in control and confident with her transition from the hospital. Through organization of important documentation, she freed up more time to start healing from her experience, spend time with Becky, and take care of herself.